there, friends, and welcome to Season 9 of the Lighting Your Way podcast. This season, we are continuing one of my favorite parts of the show, talking with patients about their own personal journeys through the healthcare system. These are real stories from real people, sharing the ups, the downs, and everything in between. It is honest, heartfelt, and as always, it's a reminder that no one walks this path alone. So join us as we shine a light on the challenges and triumphs of navigating healthcare. Here's to another season of connection, compassion, and hope. Migraines are highly prevalent, especially among women. Research shows that approximately 12% of the population experiences migraines, but the condition disproportionately affects women. In fact, women are about 3 times more likely to experience migraines than men. This gender disparity is largely attributed to hormonal fluctuations, particularly involving estrogen. Migraine attacks in women often start in adolescence or early adulthood and can peak during reproductive years, with hormonal changes such as menstruation, pregnancy, and menopause being a significant trigger. In our first episode of Season 9, I am joined by a very special guest, Lexi Livanos. Lexi is here to share her personal journey with migraines, a condition that impacts millions of people worldwide. In this episode, we'll talk about the incidence of migraines, Lexi's experiences living with this often debilitating condition, and the challenges she's faced along the way. It's a heartfelt and eye-opening conversation you will not want to miss. Lexi Livanos, welcome to the Lighting Your Way podcast. It's good to have you here. Thank you for joining me.
Thank you so much for having me.
I think it's going to be a good conversation. I know in our last season and now in this season 9, we are continuing our conversations with our patients and wanting to talk with them and hear from them about their journeys in the healthcare system. And you have, I know, been going through your own journey of late with migraines. But I guess, before we get into what's happening recently, talk to me about, kind of fill me in as to when you were first diagnosed with the migraines. Like what happened, how old were you, what was going on?
Sure. Yeah. So I, as you mentioned, I've been having some struggles lately, but I was diagnosed with migraines back, oh my goodness, probably 2007 is when the episode started, but I was formally given a diagnosis around 2008, 2009 is when I sought professional help. So I, struggled and then was able to kind of find some sort of help.
So you were in high school?
So that was end of middle school, beginning of high school. Yes.
Wow. And so you developed headaches, right? And that's probably unusual for a lot of people. But so what was it like? You just started to have headaches, and your mom thought they were like regular headaches, or what would happen?
Well, in a weird way, I was lucky because both she and my sister struggle with migraines. My sister actually struggles way more with them. So she was able to kind of, see that I was having a similar symptom pattern because I would notice, I would go to play rehearsal and I was just chewing Advil constantly and just getting these really weird episodes where my eye would hurt and I would have to be in a dark room, and I couldn't really figure out A, why nobody else around me was going through that, and B, just, the pain was just very unusual, to your point, at, for that age.
Yeah.
So yeah.
And so mom and sister, okay, so their mom's clued into the fact that you're experiencing migraines. So she gets you does she take you to her doctor? What was that like?
So my sister was already being seen by the headache center. So she was able to kind of start that process with me and just kind of, get me into their I'm not even sure what to call it, but basically like you have to kind of be, I guess, evaluated into it. Like it was like a full day where they just ran a bunch of tests and then you're able to get into the actual program. So she was able to
Okay.
kind of start that with me pretty early.
And what did the what was the treatment for you at that age?
So at that point, it was, get the regular maintenance medication and then find a rescue. And so it was just kind of a trial and error with just different pills.
Mm.
The rescue has remained the same to this day, which is just a nasal spray, since insurance does not cover an injectable. But
Hmm.
so it's just kind of, figuring out different pills that work. And we finally landed on gabapentin, which ended up just carrying me through up until recently.
So they put you on gabapentin. Interesting. Back when you were first diagnosed. Did that help?
Yeah. Yeah. So I would say, because we tried like the nortriptylines, we tried, I think it was like Topamax, it was a bunch of different ones. And then by 2010 specifically, I remember being on it because my mom was giving it to me incorrectly by accident. So I was falling asleep during the day. And so, because it's very sedating. So that was a little oopsie. But so yeah, around 2010 is kind of when I remember fully it in my rotation of medicine.
And so did you continue to see the same it was a neurologist that you were saying, I assume?
Yeah, so it's the same neurologist I think it was just from that point, again, up until
Okay.
recently.
Okay. Yeah, and I know that you and I have talked about the gabapentin being not typically a headache drug, right? Or I should say a migraine drug. It is a neurological drug for nerve
Hmm.
issues, and is typically used for that. So I was really surprised when you told me that you were on that, and that had been the drug of choice, from the inception of your treatment, which really I was surprised at, really, especially coming from the headache center, because you hope that
Hmm.
that's all they're dealing with. And I had not heard gabapentin being used for migraines. So what prompted? So you have this long history, right? And you're in middle school,
Hmm.
then you go to high school, then you're in college, and you're an active young woman. How did the migraine, like, what was your trigger? Did you learn how to manage them? What was your life like in managing this migraine?
So for a while, I would say they were pretty well managed. I would get episodes maybe a couple times a month. I would say primarily my triggers have been weather,
Mm.
dehydration, and then if I go like too long between eating, so blood
Hmm.
sugar,
Hmm.
but primarily weather. I can definitely tell, when it's raining or it's going to be cold or anything like that. So it's just, from, my younger years, I guess, I just had to learn to always have my medicines on me, just, it was just frustrating though, because, when you're younger and even now, you don't want to have to feel like you're living your life around
Right.
pain and
Right.
just always feeling like you're almost walking on eggshells. So while I did get used to managing it, it was still frustrating. But so yeah, it was just making sure, if I started to feel, because the pain with a migraine, you can feel it kind of switch from like a regular headache and then it will kind of basically go to where it settles. So mine, I would always feel it kind of travel into my sinus, go into my eye. And then at that point, I always, the clock starts at that point and you have to take your rescues and sometimes they work and you get to it in time. Sometimes it doesn't. So it
Oh.
would be, making sure I could find a dark room and just making sure lights are out, which is frustrating because, life doesn't
Oh.
stop when the pain is going. So that was just kind of how I was able to manage it through, high school, college, and then, semi recently. It's just kind of how I've had to live. So, yeah.
I didn't hear you say it was triggered by stress. Do you feel like
Oh,
it
yes.
has been? Yeah.
Oh, absolutely. Yeah. No,
Okay.
I feel like it's always hard because I feel like you can't always pinpoint, sometimes stressful situations,
Right.
always like, oh, maybe, you're stressed about going to a party or this, that, like sometimes you just don't even realize it. But yeah,
Right.
tension, all that is just,
Oh.
you know, definitely part of it.
Yeah, that's got to be hard. I mean, especially with all the milestones, right? That you're graduating from high school and you go into college, then you're trying to get a
Mhm.
job. I mean, it's just life
Mhm.
coming at you, and yet you have this, you know, affinity for migraines, which can be disabling, as you've described, and many people do suffer from disabling migraines and cannot, have to go to a dark room, have to manage it without their medicine, and that's
Mhm.
and that why they have a thing called the headache center now.
Mhm.
So, recently, and probably not recently, a couple months ago, you were really struggling, and you and I talked about your treatment and your care at the treatment center. I'm sorry, at the headache center. And I suggested that maybe you should consider getting a second opinion. Let's fill in the blanks with the that was a at that point you have health insurance, right? You've been seeing the headache center for many years. Um,
Mhm.
did you have a reluctance to get a second opinion? How did you feel when I said, "Why don't you get a second opinion?"
No, I mean, I think it just, for a long time, I just didn't even think of that being an option because, I mean, as a patient and especially a young patient, you're presented to these doctors, and I always just assumed, they would try everything and that I wouldn't have to maybe advocate outside of that for myself
Mm.
and my pain. And so, when the switch up started to happen, I mean, and it happened much longer than a few months, I would say within the past couple years, like, I was just chewing Advil and just feeling like, my symptoms were kind of spiraling and, doctors weren't really listening to maybe changing up anything. And so I just thought that that was going to be my life just because I didn't think, in my mind, okay, well, the doctors know and, where else am I going to go? So it wasn't so much reluctancy. It was more so just, not really thinking past that and thinking, oh, there is
Mm.
possibly another way to do this.
Mm. Okay. Okay, good. I mean, I listen. We hear a lot of times when patients, because you do assume, and there's nothing wrong to assume that the doctors and
Mhm.
nurse practitioners know what they're doing because they are trained.
Mhm.
But when you're in, like you are in a long term relationship with the headache center, that you may not have felt as they were being as attentive to you and your symptoms as perhaps you'd like them to be,
Mhm.
because
Yeah.
you're kind of in a rut, right? Like, well, yeah, here's
Mhm.
Lexi, and this is what we do for Lexi. But Lexi wasn't feeling very good at the point that
Mm-mm.
you and I were talking about that. So, fortunately, one of our nurses, Kelly, was able to help you because she also suffers from migraines, and I think that connection was helpful for you.
Yeah, I mean, the connection specifically to have somebody who experiences the same pain is so important and validating just because it is hard, at least, when you're dealing with chronic pain, it's hard to almost explain your experience because, somebody else isn't feeling it and maybe they wouldn't feel as inclined to maybe fight for a different therapy or, something
Mhm.
that maybe they tried, would work for you. And so Kelly's been really amazing at, just that and just, working through helping me make doctor's appointments during weeks where I am completely, in debilitating pain and, even just emotionally because, chronic pain just, it really will completely break you down to where you just can't even get to the doctor's appointments or think
Right,
clearly or just you
right.
you really are kind of outside of it. So Kelly's been really such an integral part to, helping me get the proper treatment by, keeping track of my doctor's appointments. Hey, Lexi, you have, this appointment coming up, we got to make sure we're there, or, have we tried this? Or, even just answering my panicked calls or just me crying, just, trying to figure out what else we can do has just been really great.
So when we got a second opinion, are you still seeing the neurologist that you were introduced to through Kelly, through Guardian Nurses?
Yes. Yep.
And what was that experience like for you to have come from the previous neurologist that you've been seeing, or perhaps the headache center that you've been seeing for many years, to a new physician, to a new neurologist? What was that like?
Well, it was definitely met with a little bit of reluctancy, just because, I came to them in such pain that I just, in my mind, I was like, my last doctor didn't even talk to me until I was in the emergency room. Is somebody else going to really be able to help me? So there was a little apprehension. Not maybe so reluctancy, but apprehension. But I just, was just so desperate that, just wanted to go with an open mind. But, they were from the start so receptive to everything, both, me and Kelly were asking and, just trying to get to the bottom of where to start, just because we needed to start from ground zero. And they were very aggressive with just getting me out of the cycle, which just was so refreshing, just because I felt finally like I was being listened to, and just really was, in almost a collaborative effort with this team of doctors and a nurse practitioner. Whereas before, it felt like I was just trying to fight a one-sided battle almost with a doctor who just, yeah.
That could not be a good feeling.
No, definitely not.
It's interesting. One of our colleagues shared a quote this week about patients' reluctance. I think it went something like, patients are reluctant to share their story and symptoms because they will feel vulnerable, and they don't want to feel vulnerable when they don't feel that the healthcare system cares about them.
Yeah, I mean, wow, that's very, very powerful. Because I mean, it almost
I thought that
feels...
too. I thought, wow, like, that's the truth, right? Nobody wants to open up to somebody if they don't feel like they're going to be received. I don't want to say received well, but warmly received, right? So when the practitioner comes into the office or to the exam room and is abrupt and looks like they're busy and you're kind of bothering them, it doesn't really set a good example or a tenor for the visit. And so you clam up. I mean, I can certainly see that. And we see that all the time with patients. So to go from a practitioner that you were with for many years and then to go to a new one and to have them, as you said, like you felt like they were listening to you, like that, I can't tell you how many times we hear that from patients, because if our nurse is with the patient, like Kelly was with you, there's often a heightened sense of, I don't want to say customer service, but so I go into to the exam room with you, and the practitioner knows that you have a nurse advocate and kind of ups their game a little bit, I guess. If that's fair.
Yeah.
So I'm glad to hear that you felt listened to. And as a result, hopefully, you have maybe better care. How are your symptoms now, or how are you doing now clinically?
So we were able to break the very long cycle through, many hospital visits, many infusions, different pills. We were finally able to break it so that I wasn't going to bed in pain. I wasn't waking up in pain. I wasn't, I was finally able to get back to work because I had to take time off. I could actually get back to my life, which was all I wanted. So yeah, I mean, I'm definitely better. I would say, we're still an uphill climb, but I was finally able to get new medicine, new therapies that I've just wanted for a really long time, because I would even have my sister, my mom, be asking, why aren't they trying medications we're on? Why aren't they giving you Botox?
Okay.
It felt like, nothing else was being given. So to
Huh.
finally have that and have my symptoms lessen, it's just been a huge weight off my shoulders. And just even emotionally, it's been so much, it's just been a really good time to, feel refreshed and just a little bit better.
Yeah, I can imagine. Are your sister and mom still being seen at the same place?
So my mom goes to someone different. I think my sister still
Hmm.
goes to the headache center, but now goes to a different doctor because we actually
Okay.
both were seeing the same doctor, but she actually goes to a nurse practitioner now.
Okay. Good. And you feel like you're maybe getting to a better place now with the different meds, and that's of course huge. What other treatments have they suggested besides the drugs? Is there some therapies you were saying about?
Yes. So something that I didn't even really know about was just for emergency situations are infusions. So those have been huge in just knowing that that's a possibility to go in for if I'm having a really bad week. We've gotten a pill on board again to break a cycle called olanzapine, or I think that's
Okay.
how you say it. And then also the big one that I was praying that I would get was Botox. So
Hmm.
I was able to get that as well as nerve block injections, and that has been life changing in a way
Wow.
that I knew it would be, but oh my God, I'm like giddy thinking about it because it was, over a couple of weeks, I was like, oh my gosh, I don't have the pain like I did. And it's not perfect, but, I've had it explained to me that, it will only get better. So don't be discouraged, which is also really refreshing to hear from, a doctor. They're, realistic about the
Right.
expectations.
Right.
But yeah, I feel much better knowing that there's just, therapies on the ready to help me,
Right.
whether like instead of just before just kind of left to go to the ER and calls unanswered by doctors. So it's been really nice.
Right. And I guess when I was listening to you say that, I think you also might, and I don't want to put words in your mouth, but you might feel hopeful.
Yes. Oh my God. Yes. Just even just about the future of what I can do, pain free. Just, it
Hmm.
feels like my life is finally it's getting back to where it was. I'm thinking about doing shows and I'm thinking about, not nervous to go on vacations because what if I get a bad flare up? I
Okay.
feel much more managed.
Good.
So
That's
definitely
great.
hopeful. Yeah.
That's well, listen, that's a huge accomplishment coming from many years of not feeling listened to, right? And
Mhm.
you're young, right? You're young, and
Mhm.
everybody should feel hopeful, according to the treatment that they're getting, right? And certainly you've seen some
Mhm.
improvement, so that's wonderful to hear. All right, so now I have some tough questions for you.
Uh-oh.
Don't worry, I don't want to induce a migraine. No, no.
Yeah.
So
No, none of that.
no, no. So you have. Let me ask you this: what lessons or lesson have you learned about your own health care having this experience?
Hmm. It's okay to question. It's okay to question and advocate past what you're being given. Because if I maybe had done that sooner, maybe it wouldn't have been as long that I was in the pain that I was. So definitely to question,
Okay.
definitely.
Very good. That's a great lesson. I'm sorry that you had to go through all that you went through to get there, but a lot of our patients are their whole lives and they don't question. And
Mhm.
we as nurses think, hey, it's okay. The question, right? I mean, I think to have a conversation with your practitioner, whether it's a nurse practitioner or or a physician, that's part of the charm of having a relationship with them, that you can talk it through and have them explain it in terms and ways that you can understand. and to
Mm-hmm.
challenge them, like, well, why haven't we tried this drug? And what's your game plan for breaking my cycle here? So
Mm-hmm.
good for you. I'm glad. Okay, the next tough question is, what would you suggest to other patients who might be in a similar situation with their neurologist who don't feel like they're getting anywhere? What advice would you like to give them?
That's a great question. I would say, I mean, definitely kind of to your point, go in being a little bit more aggressive and see if they'll be receptive to maybe asking what's their game plan, what are we doing here? And if, the doctors are maybe not receptive to that, I would suggest, because it's what helped me, is getting that second opinion if you're able to, and really try to find a team that is willing to listen to you and work with you, because that has been life-changing to have a team of doctors who wants to see you get better, cares about your input, and is just there to just make sure that you're better. So I would say, find that second opinion if you're not getting what you need, because it will make a very big difference in your pain journey.
Lexi, that is a fantastic way to end this. That's a very inspiring answer. Thank you.
Thank you.
That's a great way to end. So is there anything else that you want to say that I haven't asked?
No, just thank you for having me. This has been a great conversation, and I hope it can help someone.
I think it might, because that was a great advice. Certainly to question, and if you don't feel listened to, find another somebody who is going to listen, right?
Mm-hmm.
I know I recently had an experience myself with a physician or physicians, and finally found one that actually listened, and it was like, wow, somebody actually paid attention. So it's
it's refreshing.
it's not the I think it's not the fault. It's at the behest of the healthcare system, because everybody's so busy
Mm-hmm.
and short staffed, and they get into a routine, right? Because a lot of patients have the same complaints. I think they forget to listen. So it's up to us as patients to kind of stop them and challenge them and say, hey, I'm listening, I need you to listen here, right? So good for you. I'm glad you're
Exactly.
feeling better. And I really am happy that you're on the right course. So congratulations, and take care of yourself. Don't let those doctors take advantage of you.
Will do. Thank you so much.
Okay. All right. Take care. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.